Without further ado and delays, let's start tonight's discussion. Tonight, we're having a discussion on rebuilding strength during and after breast cancer, a focus on breath, body, and recovery. Good evening, everybody, and welcome to tonight's session, sponsored and hosted once again by the Breast Health Foundation. Today, we're going to discuss the importance and often overlooked part of the cancer journey, recovery after and during breast cancer treatment. Completing treatment is a major milestone, but many patients quickly discover that recovery is not simply about waiting for the body to return to normal. It often involves rebuilding physical strength, restoring confidence in the body, and helping the nervous system recover from the stress of treatment. We'll be exploring how clinical care, structured rehabilitation, and integrative practices can work together to support healing both during and after treatment. Our speakers tonight, starting off with Professor Carol-Ann Benn, breast surgeon and director of the Breast Care Center of Excellence. She's bringing a clinical perspective on breast cancer treatment and recovery. Wendy Vermaak, a biokineticist with a special interest in exercise oncology, working with patients to rebuild strength and mobility through structured rehabilitation and movement. And last but not least, Ann Stewart, the founder of the Institute of Integrated Wellbeing, specializing in breath, body, and mind integration, helping patients regulate the nervous system and reconnect with their bodies after illnesses. Thank you all for joining us this evening.
Thanks.
So many people expect that once breast cancer treatment finishes, life will simply return to normal. However, patients often describe recovery as a period that can be physically demanding, emotionally complex, and sometimes quite uncertain. From each of your perspectives, I'd like to begin tonight's discussion with a broad question. What does rebuilding strength after treatment actually mean? Is it purely physical recovery, or does it involve rebuilding emotional resilience and confidence in the body? While you think of an answer for that, I'm going to welcome interaction from our audience. Feel free to use the chat function or the Q&A to put your comments, your questions to any of our speakers, and I will address them to the speakers over the course of tonight. Prof. Ben, would you like to start answering the question of what does rebuilding strength actually mean?
So what I want to start off that none of us start out as superheroes, okay, with that we can do this and manage this and run this, etc. So we all need to realize our limitations and our weaknesses and what we can't do all the time. Okay, I can't touch my toes. I'm still in beginner's Pilates for the last couple of years, but I can swim, right? Okay. So that's the first thing. So when you land up with a cancer diagnosis, okay, for a lot of people with any trauma that you go through, you suddenly think this is it. I got to sort out so many things in my life. And again, we all go through that every day. No one's perfect. We can't get it right. And we just got to wake up each day and say it's a new day and we can try. I think what you need to realize is that your journey starts at diagnosis. It's not just about, oh, I've gone through this and suddenly, whoops, now I'm going to rebuild and resort. So right from the word go, when you have a stress or trauma, you've got to equip yourself to manage that, what I call the active part of your journey, and then going forward from there. So these are really important aspects. That's why I'm so pleased to have the team on that we've got on, because people have often heard me say I survived SARS-CoV-2 with music playlists and just blotting out the rest of the world. You've got to have what I call your distraction or your rubber ducky techniques, and then you've got to incorporate that some form of gentle exercise during active treatment under the care of people who have a special interest in it, because it's not all same. We're not all same people, and you've got to take into medications and cardiac risks and what can you do and where you start. So it's really important that you have a team, okay, and that you be gentle with yourself. Okay, because I use the Captain Marvel analogy, and I've often done it. Having a cancer diagnosis and going through treatment, it's like having a super blast. You have parts of you that remember the past, the old leather jacket, and parts of you that are completely different now. and you have to make your way around this. So you need everything: breath, body, recovery, a clinician team, and understand each patient's different, your journey's different, don't judge other people, and you just got to make it one day at a time. So
Thank you, Prof.
stop and let me listen to the experts. Okay.
Wendy, if you'd like to address the question next. What does rebuilding strength after recovery actually mean for you?
No, I think Prof just nailed it. It's very individualized. And so one other person can't tell another person, well, I can do this and I can do that, and you should do the same. And so yeah, you want to find your crew. Definitely. And I think that rebuilding is a team aspect, yes, with your clinicians, but also with a supportive structure, even from your home, your caregivers, your family, etc. And since we know exercise is good for you, we know this is a no-brainer. It shouldn't just be good for you, it could be good for the whole family. There's so many ways of making this rebuild another part of a journey. And it's a journey. Yeah. So you can't expect to be from X to Y. It's again, like progress, not perfection per se, is all I really would want to say with that.
Thank you very much. And if you'd like to wrap up that question for us on rebuilding strength after treatment.
Sure. Just good evening, Prof Ben. Hi, Wendy, and thanks to Jenna for having me this evening to be a part of this conversation. From my perspective as a yoga therapist, if I look at that word strength, I wouldn't say that that is purely muscle. We know that there is the physical aspect of it, but there is also nervous system resilience and rebuilding trust in your body. So from a yoga therapy point of view, we talk about the importance of felt safety. And we work with the biopsychosocial and even spiritual methodology of the person and seeing the person as a whole. And then we look at how small cues to your body can begin to build trust again. So gentle breath awareness, supporting physical posture, and that could even be in a chair. Co-regulation is very important and why these spaces are so meaningful. And I would say definitely consistency over intensity.
That's wonderful to hear. And it's nice to see that we have three very different perspectives tonight that can all work in conjunction with each other. I'm going to ask each of you to elaborate a little bit from within your specific profession. Prof, let me start with you. Perhaps we begin with the medical perspective. When someone has undergone surgery, chemotherapy, and radiation, the body has experienced a great deal, sometimes more than the patient realize what they've gone through. They're sitting there and they're focusing on just getting through this treatment. From a clinical perspective, what has the body actually been through on this breast cancer journey that patients might not fully be aware of or appreciate when they begin their road to recovery?
Well, I think let's start just with any cancer journey. Like we said, you start with a baseline. Each person's different, and you have your different levels of reserves, both mental, spiritual, and physical, and then you land up with different types of treatment. So many often spoken about different types of cancers, which involve different treatments. So don't compare yourself to the next person. Each cancer is individual, each patient. The types of treatment you will often go through in one or different orders, and sometimes more than one, maybe include and not always chemotherapy, which what is really, is oncology drugs, okay? Chemotherapy is what people understand is actually cytotoxics, things that kill cells, okay, and they have effect on all cells in the body, okay? So if you are going to start your mind and your body and your wellness and your health and your training, you need to again do that with your clinicians need to inform your what I call recovery and survivorship team, your exercise specialists. Very important to do gentle exercise during your oncology treatment, but it has to be done under supervision. Some people require targeted therapies or immunotherapies, and those also again can affect your bodies in different ways. Surgery is All of these things are trauma. And we have to at some stage do something on compliance. My heart breaks when people are not compliant and I see what we do. You can manage anything as a team, and I know it's frightening, but with a team you can manage it. The next aspect around surgery. Surgery today is less is more. Smaller operations, we take less glands, but still we have occupational therapists in the unit. We see very little lymphedema, but different surgeons operate in different ways and different teams in different ways. And you need to have clear instructions about what you can and can't do around your surgical journey. Then radiation, you are not allowed to get things wet when you have local radiation treatment. And then post-treatment, post-active treatment, it's really important. A lot of people are on endocrine treatment. A lot of people just feel like their body is completely changed. They're in menopause. They're different emotional, sexual health, other issues. And often you look at yourself and you go, blah, kind of like when you come home after a baby and you think, whoa, this is me, okay. And I always say it's only in the Hello magazine that you can stand up looking in a Sly City 2, looking fabulous. Most of us honestly feel like all our bits are falling out, right? And that's often the same thing around a cancer journey. So that is a slow recovery. Slow recovery. I mean, when I had complications with Caleb, I went from running 10Ks to not even doing 2Ks in 20 minutes on a treadmill. And I had to be gentle with my body and slowly get to a phase where I could do never what I could do before, but different. Okay, so you need to accept that. But by getting yourself into using both people like Ann and Wendy, what you are doing is you are creating a support team to help yourself manage the medication and the chronic effects around it. And not everyone has chronic side effects around treatment. So I don't want people to look at this and say, I'm going to run away because of. Okay. Not dealing and not taking can result in even more problems. Okay. More problems. Cancer's metastasizing. Exercise in itself will decrease your cancer risk by over 42%, even if you've had a breast cancer. Mental health. Yoga, breathing, music therapy, etc., have all been shown to make happy immune systems. Okay, and that helps as well, and will help the doctor with your treatment and your treatment compliance. That's really it from my side. Okay.
Thanks, Prof. That's very detailed and very useful.
Yeah.
Wendy, from your perspective, the role of rehabilitation, your work focuses on helping patients rebuild their physical strength, but I believe it's more than that. It's not just rebuilding, it can be maintaining. And even before the treatment journey starts, we've seen benefits of biokineticists helping out our patients for the upcoming treatment that comes. For those who may not be familiar with the field of biokinetics, what role does a biokineticist play in supporting patients during their cancer treatment and recovery?
Yeah, thanks. I guess I take for granted that I know what a biokineticist is, but not everyone actually out there also does. So biokineticists are healthcare professionals. We're registered with the Health Professions Council of South Africa. We are clinically trained using exercise as our modality of treatment. So ultimately, exercise is medicine, and particularly as a prehabilitative form of treatment for your cancer patients during active treatment, as well as now post-treatment. So we will meet the patient with where they are at. So it's scientifically based, research-based, individualized prescription. And the individualized prescription is really important here because as we keep saying, each patient is different. They also bring to the table past issues, whether it be orthopedic problems, whether it be comorbidities, obesity, diabetes. All of those things need to be well managed clinically using exercise as their modality. What is nice is when you are consulting with a biokineticist, it's tailor-made specifically to the patient. But aside from that, we do a lot of objective testing. So it's measurable. Is our treatment having measurable, valuable results? Because we are doing ongoing treatment often with our patients, oh, I beg your pardon, my toddler's at the door. Sorry. That's all. Okay. Okay. Sorry, everyone.
No stress at all.
I think I'll come back to that if you just give me a
We'll
moment.
come
I
back
beg
to
your
you in a
pardon.
moment. I am going to answer some of the questions in the chat, and then we're going to have a discussion with Anne about the nervous system. I do see that someone has asked if it's possible to get the contact numbers of our guest speakers in the chat. I'm sure we can arrange to do that. And I'm loving some of the comments that people talk about their road to recovery. Rebuilding strength after treatment is about physical, mental, and emotional recovery process. And rebuilding means identifying the emotions, processing this, regulating their nervous system, and it's not an easy process. Definitely one step at a time and one day at a time. And understanding the nervous system. Your work focuses on the relationship between the body, the breath, and the nervous system. And if you were to do a quick Google of it, you'd get a lot of very intimidating looking words. Could you explain to me and to our other listeners here the relationship and differences between the sympathetic and parasympathetic nervous systems, and why this balance plays such an important role in healing, in emotional well-being, and sleep?
Perfect. So again, my understanding of the sympathetic and parasympathetic nervous system, if I had to explain that in my own words, is that the body doesn't always get the memo that treatment is over. And recovery is often about teaching your nervous system that the crisis has passed. And your sympathetic network, it's all over your body, from your blood vessels and your organs and your sweat glands, your hair follicles, and we talk about a fight and flight response. So your sympathetic nervous system is responsible for increasing your heart rate, your blood pressure, your breathing rate. It might increase your blood glucose levels. So if you can imagine running away from a lion, you need that glucose, you need that energy for the big muscles in your body to activate so that you can run away. And it may even increase certain senses, so you need to be on high alert. So at the same time, it impairs certain functions like your digestion, like your reproductive processes, and it might even disturb sleep, things like that. So that is the sympathetic nervous system. Parasympathetic nervous system is a part of the autonomic nervous system responsible for your body's rest and digest. So here we're looking at things like your digestion is improved, elimination, urination, reproduction, your immunity, your healing, your sleep, and it brings down your heart rate. It decreases your blood pressure and your glucose levels. And it's not really that one is good and the other is bad. We need both. And it's not that I'm definitely not always calm and balanced. That's not a good sign normally for me of somebody that is in a good space, or in a regulated space, should I say. But it's your body's ability to go into that fight and flight, highly alert state when you need to be in that state, and then your capacity and your ability to be able to go back into rest and digest when the threat has passed.
Thank you for that. That's very detailed and that's very interesting to hear. And I'm definitely going to ask some further questions on the flight and fight. But it puts it in mind to me that there probably isn't a way for our bodies to know what is the difference between trauma and treatment. I mean, having a surgery must be a very physically impactful thing on your body, and whether that's being done for ultimate ultimate benefit of us or not is something that our body probably can't tell naturally. I'm going to let you finish now, Wendy, and your comments on exercise have definitely reminded me of one or two conferences that I've been to where there was a big focus on exercise oncology. And the statement came out that had almost 100% agreement from every doctor who attended. If we could put exercise in a pill, every single one of us would prescribe it to all of our patients. I'm going to let you continue with your introduction on your field of rehabilitation there and biokineticists.
Thank you for your patience. Of course, we can't plan all of our perfect presentations at this time, so thank you for that. So I was really just at the point of what a biokineticist is. But in terms of how it actually relates to our patients, this is why it actually helps patients so well, is when you are doing ongoing treatment with a patient, we're actually on the journey with you. You know, it kind of becomes our journey as well. And so that accountability and that backwards and forwards of really monitoring quite closely the patient session to session with that kind of supervision starts to pick up things often sooner needing treatment versus later. Things that could be addressed and minimized, you know, can be picked up sooner rather than later. I would obviously suggest that you see someone with an oncology specific background, obviously, because it's not the same as any other type of regular treatment. But even just sometimes picking up certain things that can be addressed sooner rather than later, that has even led to other unplanned health visits. So ER visits needing more intervention, hospitalizations are down. Just some of the stats of seeing a biokineticist for supervised exercises even brought down sort of 27% less emergency room visits for patients, a 42 to 72% decrease in unplanned health visits, and a 19% reduced hospital stay time. So these are for your patients in your current state of going through active treatment. Sometimes these things crop up that lead to hospital visits. Those are often reduced when people are doing formalized exercise. And so we keenly attune the intensity, the monitoring, what is the correct treatment type to do the treatment of this disease. And that is our goal, to make it personalized for that patient. What treatments have they done clinically? So a surgical patient versus someone on immunotherapy versus radiation, these things need to be pitched differently. And that's where we have the privilege of journeying with our patients through that.
So I just want to comment on something here that I think people need to realize that's very important. So for me, I always talk about healthcare being a human rights issue. Okay.
Mm-hmm.
And I want to say that access to and it took me a long time because I had a lot of the biokineticists come see me because they couldn't get internships in state a while ago. Do you remember around SARS-CoV-2? So now we have access to these services in patients who don't have access to medical care. So yes, it's a bit like, hey, I know nothing about everything, but I know breasts. It still means that people can call me, whether they're in government or private or anything, if they need assistance. The same applies to the team here. So we can make sure that people who don't have access to medical funding, who may require treatment, can contact in with people who have an expertise, who can let the biokineticists or the people and the physios and the OTs in the state services help you. So people must realize that this is important. And for all of us, decrease hospital admissions and happy and healthy during a hard time, looking after our mental and our psychological and physical health will make, hopefully, what is a really hard time, I'm not undercalling it, a little bit easier to manage. It's from my side.
Thank you very much, Prof. And I'm going to continue with you just for a moment. I do spot there in the background of your camera what looks to be an exercise bike as well, which is good to see. Even amongst your busy day, you get some time to do your thing.
My little, yeah.
Very cute. Moving on to a bit of the journey through cancer. And Prof, you obviously have a lot of experience in seeing patients going through this journey and post-treatment challenges. What do you think, if you were to pull one or two topics out of your head, is one of the most common physical and emotional challenges that people do experience after the breast cancer treatment journey that they might miss, they might not be aware of, and something to look out for that can be assisted, that we can help them with?
100%. So I'm going to separate it into two things. You mentioned mental and emotional. And I think what happens is once you've been through any treatment or any trauma, you have this absolute fear of things coming back and worry and concern about what's going. Every time you feel something, an ache, a pain, a can't sleep at night, a side effect to a medicine, you go for a scan. So that mental trauma is with you often all the time. And that's why breathe work, music work, distraction work. You've got a rubber ducky along through this and you need people to help you with it. So that is on the emotional and the mental side, and people don't understand it. The next, on the physical side, you feel like you've been through a washing machine. It is so demoralizing when you have trauma and you just think to yourself, gee, I could do that and now I can't, and everything's cringling up and I'm aging and I'm aches and pains, etc. And that's where exercise helps. The small little bits of helping your whole body recover gently. Okay. Doesn't mean an advanced Pilates class and be like your dad does, extreme events and triathlons. Small things, small goals. And exercise teaches us discipline and small goals because it's not easy. Okay. So that's my side.
Thank you very much, Prof.
Okay.
And I'd like to go back to a point that you brought up earlier, and it was the stress and the flight or flight response. Fight or flight, am I saying that correctly? Yes. And sometimes the body remains in a prolonged fight or flight state during and even after treatment. How can regulating the nervous system assist with this, and why does it play such an important part of recovery?
So, yeah, as Prof Ben mentioned, the physical, emotional, mental aspects. I mean, a cancer diagnosis is quite a traumatic event, and you have this ongoing stress of the scans and the treatment, possibly body changes or uncertainty. And in this pattern, your nervous system sort of learns this ongoing vigilance. And so it's very common to see clients who experience anxiety or poor sleep, or they're feeling constantly on edge, even when treatment is finished. And so in yoga therapy, we often say that the goal isn't to push the body, it's actually to create an environment or conditions where the body can recover and feel that felt sense of safety again. And really that's just done with just not pushing to exhaustion. It just really, I would say that one of the most helpful elements is pacing.
Thank you very much. It's very important to keep in mind. I'm going to ask one or two of the questions from the chat to lead into my next discussion, which is going to focus on you, Wendy, and perhaps one or two comments from Prof Ben as well. One of our comments in chat said that they find gym to be so helpful emotionally and mentally and physical. Even though some days are more challenging than other, it does help keep the mood up with some good music. That leads into the question, what kind of exercises are recommended for someone, particularly at different stages of a patient's cancer journey? Wendy, why is movement something that patients should consider not only in recovery after treatment, but also during treatment? And Prof, if you'd like to join in on this discussion as what type of rehabilitation, or I believe you coined the term prehabilitation, differ during treatment compared to after treatment. Wendy, if you'd like to kick off the discussion on that.
Sure, thanks. I mean, earlier on I said, exercise is medicine. And so some people enjoy the gym, like that participant there that mentioned it. Some people don't like gym, they like other types of exercise. So ultimately, I just need to clarify one thing. So you use the term movement. Movement or physical activity and exercise are actually different. In terms of exercise being medicine, exercise is at a certain intensity. It's not sort of your general movement during the day or just being active during the day. This is sort of dosed appropriately. So we have what's called the minimum effective dose or the optimal dose. Now, during your cancer treatment journey is not the time to now start doing personal bests and breaking records, as is mentioned before. However, there are opportunities for progress if you do start small. And so there's been, in the last 10 years, over 60,000 studies on exercise as medicine in recovery. And the information and data that's coming out of that is overwhelming of why we need to consider this as a treatment modality. But the point is it has to be dosed correctly. I would say, aside from dosing, find something that you're going to enjoy. Telling someone who hates the gym that they have to go in gym routine is never going to work. Telling someone who hates swimming that they need to do links is not going to work. So we find something that you are going to enjoy, and then you can adjust that into the certain dosing requirements, if that makes sense. Because this is a clinical journey as well, there are certain things about intensity that we do need to be concerned about, especially for our active chemo patients. We do need to be concerned about the possibility of chemotoxicity on the cardiopulmonary system, whether there's chemo-induced neuropathic peripheral neuropathy. So we have to pitch very specifically what exercise is correct, how much to do, and unfortunately that needs to be pitched on a patient-to-patient basis, because what one patient can do versus what another one can do is different. But it's an absolute that exercise, I'm going to run through quite a lot of stats here if you wouldn't mind bearing with me, of what exercise actually does do in the active cancer patient. But every exercise regime should have 4 things. So this is whether you're actually going through active treatment or after finishing treatment. But there's 4 specific modes of or types of exercise that a patient would require to do. One would be certainly your cardiovascular, pitched at certain levels. Then there's the resistance training, and this is interesting. Some people actually manage resistance exercise. That's not your long ongoing aerobic exercise. It's more your sets and reps of either body weighted exercises or resistance exercises using bands or machines or whichever, or body weight. Flexibility training, as well as balance. And balance is a very keen area of interest in my practice for proprioception as well. And those have specific effects on specific areas of the body. So ultimately, your exercise regime should have those 4 things. What all the data is showing is, if you were now bearing with me, but basically quite a high intensity dose of exercise. Now that would be high for you, okay? Just one session of high intensity exercise can actually reduce the cell of the tumor growth by 30%. That is what the brand new research is showing. So every exercise bout pitched at a certain level is actually showing with some patients. Yes, Carol?
So we got to be careful in how we look at that Dana-Farber's research, in that basically they're looking at immune-based around cells, and it's not around all cancers.
No,
okay,
it's not around all cancers.
I'm going to be clear that exercise is very good for the tumor microenvironment. Okay, so I've looked quite carefully at that data. So we can't just take one thing and say it drops the tumor size by 30%. What we've got to say is it induces the microenvironment of your immune environment to assist decrease on a tumor point of view. I just want to be clear.
No, it's not a blanket statement, but what I'm saying is it can have that kind of effect on certain tumors, on certain cells or whichever. But the point being, it affects the tumor microenvironment. So it affects the oxygenation, it works on your ACTH, works on your hormones, on your hormone regulation, your immune system. But even aside from that, just from a general patient, right, we're talking about an effect on the actual tumor. Then there's, of course, just the fact that you can maintain some of your bone mass and your density your fitness, your muscle strength. And the muscles are really important because your muscles work as an endocrine organ to release a number of hormones that are necessary for recovery and for treatment. It affects your quality of sleep. It affects your body image. For a lot of patients, they have a far better body image during this very challenging time, that they actually are empowered to look after their body. And what's nice about this is that patients are in control of this part of the treatment. A lot of cancer treatment is not led by the patient. You know, you go in, you get told what dose you have to take of what particular drug or therapy or whichever. This is something that the patients can own. It's actually very, very empowering. And the plus about exercise treatment is that there's no negative side effects. It's all only positive side effects. So for a change, you've got a treatment that is actually giving you positive side effects on your body and empowering you to make certain choices about that. We do know from an anxiety and depression point of view, exercise helps assist with that. It reduces your systemic inflammation. What am I leaving out here? Actually, exercise has also been shown to actually help the targeting of chemotherapy as well. So there's a number of clinics overseas that patients are actually, whilst having their chemotherapy, for instance, are actually exercising during that drip time. And because the oxygenation of exercise is helping direct that chemo very specifically to target area for treatment. Exercise also has a number of impacts on the negative side effects. So we are finding far less lymphedema with a number of the patients, improved mobility post some of their surgeries, and nausea is less, and even pain scales of tolerating treatments of cancer, other treatments of cancer. Pain scales are far better. Fatigue levels are far better. The GI tract is moving much better. There's far less cording in a number of our breast cancer patients as well. Plus, we have an impact on trying to stop long-term side effects like your chemo-induced peripheral neuropathy, and so on. So, yeah, we're looking at quality of life. We're looking at empowering patients, giving back some of their power in making the treatment part of their own as well. So, I mean, I can't advocate for regulating, you know, that system enough. And what is nice, I mean, like with Anne, we actually use breath work in our practice as well. And we use music as well. So, you know, it can actually be fun, and we can incorporate a whole lot of really beneficial treatments alongside as well.
Thank you very much, Wendy. And you did touch on a number of different points and topics there. Before I move on to a discussion that I want to have with Anne, I would like to just have you and Prof Ben elaborate a little bit more on exercise, particularly with chemotherapy, because the question of whether it's safe to do this and activate your cells, especially during chemotherapy, whether it's going to cause the spread of the cancer. And you even mentioned yourself earlier on in that talk, Wendy, that chemotoxicity and the impact on the cardiac system is something that is needed to be taken into account. We just have a little bit more of a focus on exercise for our chemo patients in particular.
So I think, and you know, I have been pro the concept of exercise and exercise oncology. I think the first time Virgin came into the country, I wrote their lead article on the value of it, and I'd love a cancer vitality program. But I want to be cautionary here, okay? This is not a concept of you're going to put on your running shoes because you've been diagnosed with a cancer and you're going to run yourself and not treat or on this. These things have to be done carefully. Everyone has a baseline. Everybody has different tolerance to different drugs. And in all our oncology patients, they have a cardiology assessment. And your clinician has to speak to someone who has a special interest to work out what you do. Studies around, and they are like we have consents and multiple studies in this unit, have to be done in strict, careful environments. And being the ultimate nerd who writes articles all the time and is busy with looking at exactly this, the tumor immune thing in cancer exercise, you still need to make sure it's done through a sensible way, because things can go horribly wrong. Okay, so it's about, we are all very, very pro, and I can honestly tell you that I consider exercise and mental health, what Anne's talking us through, well-being, breathwork, recovery, equally important to every aspect of treatment, okay? But they are medicines in themselves. I think that's what, Wendy, you should be saying. You've said exercise is a medicine, and medicines are not taken just willy-nilly. Because my friend is taking this tablet, I'm taking this tablet. The same applies to your mental, psychological, and exercise well-being. Right, Dom, I think
Thank you very much, Prof. That does answer it. But what's good for one person isn't always good for everyone else. I'm going to take this point, we're about halfway through tonight's discussion, to remind our audience, thank you so much for your comments in the chat. I am reading all of them. I will make sure they get to the speakers. And if there are any specific questions, feel free to post them there and I will ask them on your behalf. And I wanted to have a discussion with you on a very commonly brought up concern of our patients, which might not be something that can be easily solved with a get out there, get healthy physical attitude, but it's much more mentally involved. The comment comes across about after treatment, people feel that they're no longer in their body. They feel like there's someone in an alien body, and that reconnecting with their body is very difficult. How can different treatments such as breath work or nervous system regulation and mental health help patients reconnect with their bodies and try and rebuild that sense of safety and trust within their own physical self again?
That's a great question. And I think what we've mentioned previously is that every individual, every human being, every treatment would be different and you'd come from a different approach. I think that's also true in terms of, I would say, even on the day-to-day. And maybe even more specifically, something that worked for somebody maybe last week is not necessarily going to work on that day that you see them. So in my experience, many of the clients that I see, they experience their body in this sort of medicalized way. So they've been scanned and treated and maybe even operated on. And the breath can be such an easy and a gentle starting point in to making that connection again. If it is the correct breathing practice, because we know there's so much information available and even online, and I mean, certain breathing practices can actually have the opposite effect and make you feel more anxious than calm. So I think that shift can be very powerful, and I think that that relationship between feeling disconnected from the body and then using the breath as the entry point to view the body again as something that you can listen to. Again, we start rebuilding that sense of safety. And things also, I saw in the comments, somebody said laughter. So humor, I think that is so great, that co-regulation, that having a cup of tea, even before getting into a practice or a movement or a modality, just sitting together, having a cup of tea, maybe chatting for a little bit, having a laugh, not to make light of the situation, but just to bring that humor back in again. I think that can help to start repairing, for a client to see their body from being something that's broken or not necessarily working with them to something that is actually incredibly resilient and that is actually working with you as opposed to against you.
Thank you very much. Definitely so. And we can definitely, I'm going to try and slowly wrap this conversation back around to Wendy and almost ask a very personal question that perhaps she could answer, and I'll listen very carefully to get into it. Fatigue and pain, it prevents many patients from doing physical tasks. There's questions that we've received in the chat about, isn't it dangerous to continue intense strength training post-treatment? How does one get back into training if they've done almost nothing for an extended period of time? But we know that this is there to help us. And we even had 1 or 2 patients comment that due to their specific treatment, they were actually advised not to undergo any exercise for up to a year after treatment. And then that means that they had to get back into it from almost a point zero. And I see you do looking a little bit confused there, Wendy. It was specifically after a brain radiation and brain surgery. Perhaps it was a very specific case there. From someone such as my own point of view, who does have a very stagnant lifestyle, I find myself congratulating myself if I park my car in the far corner of the parking lot to walk to the grocery store that extra 20 steps. And that's where the idea of movement in my comment earlier probably came into. But how does one address this starting again, this managing the fatigue and getting going from not just a point of low, but almost a point of zero, knowing that we want to? Perhaps Anne and Wendy, you can address those questions. Prof, welcome.
Dominic, I'm going to say that people often look at what they were like in school and they participated or didn't participate, or they were involved in this exercise or not. Starting exercise programs is and can be, to be corrected, harder than this concept, I'm going to start my diet. And everyone goes Monday, okay? And I think that what we must do is create a little bit of joy in life and stop being so hard on ourselves. So simple habit change starts the process. Wendy's absolutely right. It's medicine, and actually you need to look at, I'm fascinated when I see my Barbie boys who've trained themselves silly but can't run not even 50 meters because they are beautifully muscled and look wonderful, but their ability on the aerobic side. So it's 4 pillars, right? 4 pillars. And I think the thing is to find something that you enjoy, what you guys said. Enjoy. So don't be hard on yourself that you have to do 27 bench presses and this and that, or run a 10K. If you think outdoors is nice and you like to get into possibly walking and running, put some shoes on, start by going for a walk through one of the parks, and then do it with your music on. And then slowly, instead of walking the whole thing or panting on the uphill, you will slowly get into it. Go to the Spray, go do things in groups, please, guys, in this country, just not on your own, and be careful on the roads and early mornings and cyclists, etc. My stationary bike here has got more things on it than anything else, but it's got a very funky little something, and yep, and it's so old, it doesn't have any like little power thing. But if I'm sitting on a long meeting and I'm turning my legs on a bike and I can't change, that's excellent. I have a skipping rope that I can skip outside. Be variable and don't be hard on yourselves. Everyone can start something, and find a friend, phone a friend.
Thank you very much, Prof. Wendy, do you want to continue that discussion?
No, I mean, that was some of the points that I had noted down were exactly in that. So, we don't want to use the word accountability because you're only accountable really to yourself. But having a buddy or having a friend or having a group definitely adds to the psychosocial aspect of things as well. And sometimes it's just that external motivation that you're not going to manage to sometimes have yourself. But I do just want to address when you mentioned specifically fatigue and pain. And so when I keep saying how we need to pitch things individually, that comes with regards to monitoring what state the patient was actually prior to treatment as well. So if you had someone who was a marathon runner, their capacity will be potentially very, very different to someone who didn't do anything since chess in high school. So you're going to have to pitch each patient differently. We have the privilege of being able to, with our patients, monitor very closely heart rates. These are very specifically calculated with specific formula based on the patient, their age, what their resting heart rate is. So we're not just saying go out and run yourself ragged around a gym or outside or whichever. It does have to start slowly. If there was a mention about someone, is it safe to do, high intensity resistance exercise? If you are a general typical exerciser and you can continue that kind of strength training, where it's not going to over elevate your heart rate out of those parameters, that is perfectly safe. And in actual fact, the resistance training data is showing huge strides in the treatment and management of cancer. So by all means, if that is what works for you, I would do a consult check-in just to make sure that it's being pitched correctly, but it is safe to do so if it's manageable to do so. Then in terms of the fatigue and pain, cancer fatigue is not just being tired. We know this. This is a totally different kind of fatigue. We have a generalized view, and I say generalized because, again, it depends on some patients. But if we have fatigue scales and pain scales, if a patient is hitting like a 6 out of 10 fatigue scale, then it's not recommended to do exercise at that kind of level, rather at a lower fatigue scale so that they're going to be actually able to do something. Pain scales, similarly. Some pain does need to be managed with the help of the doctor, with certain medicines and so on. So it depends on what's going on with that patient as well. Most likely, even when fatigued, even when in a little pain, even when people don't feel like it, once they start a little, they do pep up and it gets better and better. So again, don't aim for perfection, aim for progress. If you are able to pitch it at those higher intensities within the certain realms, by all means, go for it. It's certainly not to say you mustn't. We really are advocating for that. I like to include different rhythmic exercise, recommending someone to do dancing if they don't want to go to the gym. Some people want to do rebounding. Some people like yoga. Some people like Pilates, whatever it is. But something that's going to help you be consistent is really important. What else can I say? That you mentioned fatigue, pain, and the safety. I would say if you are being well monitored and looked after, then the safety isn't a worry, type of thing. If you are concerned, a consult, even if it's just to check in, is really a good idea. And I would say just start with wherever you can, with whatever you can do. But as Prof was mentioning, even if it's just on a bike, just for a couple of minutes here and there, just starting, it's just to get going, certainly.
Thank you very much. And from your perspective, is there anything you want to add to that particular discussion?
I just want to touch on the point about being so hard on ourselves. So just from my own experience, I had a client and I was doing house visits with her, and on the one day that I arrived, she had actually forgotten about our appointment, and she was incredibly tired. She loves movement, she loves walking. In fact, she gets very frustrated when she actually has to, be a little bit more still. And she felt quite embarrassed about having not remembered that we were meeting or gotten the times mixed up. She was incredibly fatigued. And so, but she was sitting ready, and she had her mat out, and she was, my heart really just expanded, because I just thought, well, she's feeling fatigued. She forgot we were meeting, but she's ready for me, and she's ready to put her best foot forward. And in that, she was so tired that actually movement wasn't the entry point there. I mean, because we were home, we were able to put her comfortably on her bed. We did a guided relaxation, because a lot of people speak about meditation and you got to get your stress levels down, so you got to learn to meditate. Typical meditation is actually a really difficult thing, so that wouldn't be a starting point either. So a guided relaxation on her bed, she had her dogs with her, she was comfortable, she fell asleep, and we just covered her with a blanket and then left her to sleep for the rest of the afternoon, and that was the session. And I think that definitely, there is big value. I'm not an expert in pain, most definitely. I think it's a very complex subject, but we know that when our nervous system is on high alert, or when we're feeling anxious or stressed, that it can amplify how pain is experienced. So if she was highly stressed there, trying to get her to move or do things, she would have been more sore, perhaps even because she's stressed. And that doesn't mean to say that pain is necessarily something that's just in your head. I'm just saying that your nervous system plays a role in how strongly pain signals are interpreted. So if we can bring those, if we can, create that sense of co-regulation and safety, then I think, tissues soften, your breathing improves, and perhaps movement might be less painful.
Thank you so much, Anne, for bringing that up. And that's wonderful points that you bring up there. And I'm going to expand on your discussion in just a little bit. I'm going to take a minute or two to read some of the wonderful comments we have received in chat, and they're all very supportive. And I just want to make sure that everyone is aware of them. We have people saying that they did not exercise during their cancer treatment. To be honest, it was because they didn't feel up to it and were too scared to do any physical activity. And it's one thing that they wish they would do differently, and they would have done the exercise based on their doctor's view. It's followed up with being agreed, and that sometimes we're too hard on ourselves. Sometimes we just need to give ourselves a little bit of a break and see how far we've come, and any step is a step in the right direction. Another comment about how they joined after treatment a beautiful community gym. They got a trainer, they got motivated, and they only went once a week, slowly working their way up until they could do light resistance weights, resistance bands. It took them 8 months post-treatment to just get back to the stage they felt they were before their diagnosis. We have 1 or 2 questions of comments of what to do. They're 4 weeks post-op, and their fear is that even though they've been given the go-ahead to do exercise, they're afraid of tearing, pulling, or hurting themselves. Another person is a year in remission. They've been running on adrenaline since treatment, but lately the fatigue is starting to catch up to them, and it's getting debilitating. What sort of exercise or treatments can they do? And this leads into my next discussion that I want to bring up, is that maybe myself as one of the general public and one of our listeners are in the same boat as me. We don't really know what's out there. When I think of exercise, I think back to my day when I left high school. I was part of first team rugby, and exercises go run up that hill and you're carrying a log and you got to push it. And I can't, for the life of me, think of anything else I'd rather do. And if I went out tomorrow and tried to do exercise, I'd go to the hill and I'd try to start at the bottom and sprint my way up the hill, because that's where it is in my head. And when I think about wellness and mental health, and please tell me I am very, very wrong. I think of sitting in this little Indian parlor with some incense going and trying to empty my mind and realize I'm not going to not think about anything, because there are a million things I need to do for work and I can't clear my mind. What are we not aware of that are the options that are out there? What can we do that you as professionals realize that there's more than just one size? You've spoken so much about the correct solution for the individual person. Perhaps you can give us some examples of what these options are. Prof, do you want to start us off?
So I want to start because when I hear comments, I wish I had done this and trained, etc. All of us wish we had done something differently the day before. Okay, it's and I you know me, I try and take every day, this is a new day. Okay, I don't do New Year's resolution. Every day is a new day, and I will try and do something different, better, etc. Try is the optimal word. So I think that what you say is really important about both exercise and mental health, because we do have a mental or an idea of what we think we should do, and either our body lets us down or our mind lets us down. And that's why we have professional people to help and assist us. Help us so that we can work out ways that are best for us, and it's not one size fits all. So sometimes, I mean, I'm a playlist queen, whether I'm training in the swimming pool or doing this, etc. Because otherwise, my phone keeps on going, and 1,000 WhatsApp and 1,000 calls, and I've got to worry about this and this patient, etc. So by playing music from 5 in the morning when I'm in the car to get my mind ready for my day to when I'm training, is good for me. It might not be good for you, but it's good for me. So to clear my head is music and different thought process that's not work. So each person is different. So I want to let our experts here, which is what they are, give you some ideas about how not to be hard and how to start the process, because starting the process is hard for all of us. Whether it's going for a test to find a cancer, okay, or to go through treatment, which is what I do as a clinician, or what Ann does to help you, okay, or what Wendy does to help you. All of it's difficult. No one says it's easy, but together we can. Okay.
Please, Wendy, and if anyone wants to keep the discussion going, keep the advice, the comments, the experience, the expertise.
I
So,
think you go, Anne. I've got such a long list of stuff. I think you should start.
mine's quite short. I just want to mention, I mean, just when Prof was speaking there, I think many times, and if we speak about the mind, we want things to be different, and we want to feel different, and we want outcomes to be different, and there are obviously expectations and anxieties in terms of, you know, fear of the future. And I think that, you know, these little distractions, whether it's music or walking in nature or laughter or watching your favorite sitcom for the millionth time, and you know it really makes you laugh or just helps you to switch off a little bit, whether it's breath work or guided relaxation or anything that is considered to be under the umbrella of yoga therapy. We also work with massage therapy and with energy therapy, but I think that a very important aspect is possibly just that acceptance, and that's a big ask, but not necessarily trying to feel different. Oh, I'm tired. Now you're fighting yourself, but I don't want to feel tired. I want to feel different. You know, well, maybe you can just feel tired and you can have permission to rest today, or, you know, tomorrow is another day. I think it's just that realization and acceptance of meeting yourself always and meeting the client where they're at, as opposed to always seeing it as something, or seeing yourself as something to be fixed or needing to be different.
Thank you very much. Go ahead, Wendy.
Well done. Yeah, in a similar vein, I just, you know, I'm a clinician on the ground. So, you know, I see patients, varied patients on a day-to-day basis, which is very, very different to in the research laboratory environment. There, to get a certain outcome, things are very robotic. You have to come in, you have to perform X to Y because that's what the protocol is that they're testing. And it's, you know, it's kind of regardless of how patients feel, they've signed up for this or whichever, and to produce a certain outcome. And of course, I found that very, very different within my work environment in seeing actual people as opposed to doing like an actual robotic thing. And what I really like, it's called sort of like a co-pilot or a co-design. I start asking my patients, well, what are your goals? Because it's actually got to be appropriate for what the patient wants. And so that takes off any expectation of anyone else putting on them. It's what their goals are. And we start with that. So, you know, that's SMART goals, small, measurable, achievable goals, right? And then one of my questions often is, what do you like to do? And so some patients don't consider that certain things are exercise and that things that actually can bring them joy. If you think of kids play, their bodies move. It's tiring. They're working on strength and balance. And so sometimes I have to pitch it to my patients like, well, what would be like play for you? Some people love the gym. They love moving from machine to machine to machine. Some people like hikes out in nature. Some people like dance classes. Some people like yoga. Some people like Pilates. There are a million different types of exercise. I would say, what do you like to do? Because you're more likely to continue doing something that actually brings you joy. Something that's actually going to be sometimes social, I agree, rather doing it in groups. That psychosocial aspect is massive. Some people are more reclusive and like to do things at home. We live in an age of information of an enormous amount available online. There are online groups, there's online guided exercise regimes or whichever. There's a million things that someone could do. So what I would say is, if you have very little time, capacity, and direction, we all mostly can walk. So you can start off with just walking, even if it's walking on the spot. But try and find something that you love and enjoy. And I think, you got to try and find those moments that's going to bring you joy in that. And this is a way to actually do that. Make it fun, make it playful, make it challenging for you. And the idea is to not beat yourself up when you've missed a day. You pick it up again tomorrow. We can all live in those regrets. I'm like, leave those regrets behind and find something that you'd like to do.
Thank you so much. That's wonderful information. And I would also like to bring attention to one or two more comments that have popped up. We're having an amazing discussion tonight, both by our expert panel and in the chat feature of this meeting. Something that I'd like to bring attention to. Acceptance is very tough, and learning to let go of the old you and be kind to the new you and showing yourself grace is difficult and essential. And that goes hand in hand with another comment we get, that consulting with your medical team every step of the way is important, and the multidisciplinary treatments is important. Your body, when you're going through oncology treatment, is going through quite a drastic change and is having a lot happen to it. And perhaps you don't always know what you'd expect you can do or what is good for you. I know that if I was to suddenly start exercising and I couldn't do what I expected myself to do, I might push myself a little bit harder than normal, and that is why we have this support team of experts alongside us. What I'd like to do, as I'm slowly starting to wrap up tonight's discussion, is I'd like to ask each of our speakers to consider what one message they would like our listeners to take away with from today's discussion. If they could consolidate that down into a short thought. Prof Ben, I know you like starting us off on those things, which is why I'm emphasizing a short thought or a short message from you before we go on to some of the closing statements for tonight.
It's good because they're going to call me to theatre just now. Two things. You got to have a rubber ducky mentality. Just bunt along. You're going to have big waves and low waves. You'll get there slowly. Just keep on paddling with other little people and duckies around. And Captain Marvel, what we were yesterday, we're not today. You take your superpower, okay, and know that little bits, little change, etc. You can remember the past, but you've got to accept what we are today and help us to grow to something tomorrow. So that's really all from my side. I did my body tech today and I'll do my swim tomorrow, and I swim like a granny, but I do it. Okay, bye.
Thank you very much, Prof Ben. Definitely take that to heart. And I love how you always say is the only thing constant is change. We will remember that. Anne, do you want to go next?
Sure. I think that the key message that I'd like to leave with everyone this evening is just that progress doesn't have to be fast in order to be meaningful.
Thank you very much for that, Anne. Wendy, your final comment?
Well, for a change, you are in charge of this type of medicine. That exercise being medicine, you can be in charge of that. And that's just such a wonderfully empowering thing. Start small, progress, not perfection. And when in doubt, then consult, because rather don't live in fear, rather get knowledgeable and empowered so that you can move forward, which is for you. You don't need to do this for anybody else. You just need to do it for you.
Thank you so much, Wendy. And I'm going to pick a comment that I spotted in the chat that I believe is wonderful. It feels scary because it's unfamiliar, not because you are incapable. I'm going to hand over now to Jenna from the Breast Health Foundation. All these webinars and these sessions are only capable because of the motivation and the drive from the Breast Health Foundation, who gets these together, who gets our expert panels. Jenna, if you'd be so kind as to join us and give us a couple words of support and comment from the BHF. Thank you so much.
Thank you very much, John. So first, I'd like to say a very big thank you to our speakers, Prof Ben and Anne and Wendy. I think tonight was a wonderful collaboration of looking at different aspects and the different professions of people and how we can use all of these different aspects to help ourselves as patients to get to a space where we are content within our body, to where we feel peace. And as a cancer survivor, that's not an easy place to be in. And I think it's what everyone strives to get to, is a place of peace. And there's been so much advice tonight. I've been making notes and I feel like there's still so much more to make notes about. And there's been such wonderful, wonderful, supportive, loving, understanding advice. A few things, and I think number one is everyone is different, and understanding that everyone starts from a different place, everyone's treatment is different, everyone's body is different. So someone might be running marathons and someone else might be doing something else, but it's all up to you. And as a cancer survivor, you have to get to a place where you know that you have a new normal. Let go of your expectations of what you were pre-treatment, pre-cancer, and get to a place of acceptance, which is big and hard to get to, but a place of acceptance of your new normal, and be kind to yourself within that new normal, and start small. Progress. We heard a lot about progress not being perfect, progress not being quick, but just starting small, with a small something that could make a little difference. I've been reading through the comments as well, and I think it could be as simple as just creating 10 minutes throughout the busy day for you. And that could be 10 minutes of walking on the spot, or 10 minutes sitting and having a cup of tea and breathing. But 10 minutes for you. And I know as women, we often don't stop. We just carry on going. So try and get to a place where you give yourself time, give yourself 10 minutes, do something that fills your cup, brings you joy, and slowly you'll get to a place where you go, oh my word, I'm doing this now. I'm walking a K, or I'm swimming 10 laps, or I'm breathing to the count of 6, or however long I'm supposed to breathe for, and not, freaking out. So
Thank you so much, Jenna. Unfortunately, it does look like we might have lost connection with you there.
Oh, there we go. I'm back.
Fantastic.
But if you are not sure of anything or where to start, you're welcome to contact the Breast Health Foundation. We'll always be able to direct you to someone that can assist, some kind of advice, support groups, healthcare professionals, things like that. So if you're feeling a little bit like you don't know where to start and you're completely lost, come on over. We'll have some good laughs. We're all lost sometimes.
Thank you very much. Thank you very much. I'm going to reiterate to our two guest speakers the first question that came through tonight. If you'd be so kind, if there's any way that people can get more information, get in touch with you, get in contact with you, if you want to just drop in your chat an email address, a website to go to, if there's a community WhatsApp number. Jenna, I know almost everyone here should be in contact with the BHF, but perhaps you also want to put some of those details in the chat as well, so that we keep this community alive and going. I'm going to give one final thank you to our speakers for sharing your experience and insights tonight. Recovery from breast cancer is not simply the end of treatment. It is the beginning of rebuilding strength, restoring well-being and reconnecting with your body, which we have learned so much of tonight. We hope tonight's discussion has provided guidance and encouragement for patients, families, and healthcare professionals alike. So thank you to everyone who joined us this evening. We will be putting a recording of this session on the Breast Health Foundation social media platforms. Please keep your eye out on however you did hear about tonight's session. There will be more sessions this year. We do have a number of them planned, and we look forward to the next one. Thank you so much, everyone. Thank you to our speakers and to our community. This would not happen without the interest from you. Good night, everyone.